So good evening, everyone. I believe we are all on the Africa timeline. I can as well say good evening, but for those who are not in Africa, good morning, good afternoon, wherever you come from. My name is Dr. Joy. I'm the Secretary General of Wonka Africa, and I'm a family physician working in Kenya, a rural area called Baringo. And I'm excited to be here today hosting this session for AfroPHC with the nurses. And I would like to wish all the nurses happy Nurses Year. It's exciting to be celebrating all of you and to actually highlight the work that you do in all your areas. So a bit more about AfroPHC. AfroPHC, if you can all see the slides in front of you, AfroPHC brings together leaders from the PHC team, and our aim is to bring family doctors, nurses, and clinical officers, community health workers, all of them together in one platform so that we can be able to share our challenges and be able to highlight what our issues are. We support each other in development, and that's the main aim that AfroPHC is aiming to bring within the Africa platform. Then advocate for appropriate team-based PHC under the UHC. We've spoken across all countries. The main talk that has been there has been all about UHC, but PHC focus has not been so much highlighted, and we are the providers for UHC. So that's why AfroPHC was formed, so that it can be able to highlight what we do in a bigger way. So moving on to the next slide. I would like to orient the team that's already here. We have this Zoom platform. Would like you to at least understand a few key things before we start the session so that we do have a smooth session. One, there is the mute button on your left. Would like that maintained during this discussion. Would prefer the key stakeholders who will be hosting this session, who will be introduced to you shortly, will be the ones running the show, and you can take time and be able to ask questions from the chat, this arrow here. I'll be managing the participants, and there's the mute button on your left-hand side. For any messages, you'll find them on your right-hand side, where there's either messages to everyone, or you can, if you're chatting with one individual person, you can as well inbox them privately and have the dialogue as a private dialogue if you intend to have one which is private. So please do not press the end button, which is at the bottom. Also, do not forget to join AfroPHC. Our website is as follows. I'll share this also at the end of this meeting. You can join our regular webinars, which really we will be hosting at least regular webinars in the coming few days and moving forward to highlight what we do as primary healthcare stakeholders. This week, it's the nurses. Next week, on 21st, we'll be having the doctors and clinical officers. And the following week, on Tuesday, we'll be having the community health workers highlighting what they do in primary healthcare. Then participate in discussions in our Google group. Through the website, you'll be directed to a link that will enable you fill out a form that will bring you into the Google group. Then do online training on leadership and management. There's a lovely course coming up that's being offered by AMREF Africa, and we'll be able to be undertaken by anyone, anywhere in Africa, and this will help enhance our leadership and management skills. Then link up with PHC team leaders in each country and form a local AfroPHC forum. Different leaders have highlighted a number of issues which can be able to be mitigated in each of your countries, wherever you are. Join us at the AfroPHC June conference, which you'll find on the website. This will be an exciting forum to highlight what we do as primary healthcare and plan going forward what we intend to share with our governments and our workplaces so that we enhance primary healthcare. So all those details are on our website, and do look into it and be able to share more. So I welcome our panelists today. One of our panelists is Bongi Sibanda. She is an advanced practice educator, health consultant, and advanced nurse practitioner with specialty interest in interprofessional education collaboration and health policy. Her areas of clinical and teaching expertise are in advanced practice and emergency and primary healthcare research, ethics, and clinical leadership. Bongi will highlight more about what she does as we go ahead with our discussion today. Our other panelist is, I'll highlight Judy, Judy Konyola. Judy Konyola is a nurse in Kenya, and she is the UGHE new chair of nursing and midwifery. Judy will share more about what UGHE. Please mute your mic so that we do not hear the background noise. Our new chair, she's the new chair of nursing and midwifery, that's Judy, and she's a registered community health nurse and midwife, and a recognized nurse leader in Africa with over 25 years of experience in clinical nursing and midwifery education program. She has led HIV programs and provided technical support to NGOs and the public sector, working with partners and ministers of health in multiple countries across East, West, and South Africa. She has a bachelor's degree in nursing from the University of East Africa, Baraton, and master's degree in advanced healthcare practice from University of Manchester in the UK. Judy is also an African representative for Nurses Now and global champion to raise the status and profile of nurses and midwifery. I'll leave it at that and ask Bongi to say hello and also introduce herself, then followed by Judy as we prepare a presentation from Bongi. Welcome, Bongi.
Hello, everyone, and thank you for joining us today. I'm really excited about this webinar and the work we are doing with AfroPHC, Anglophone AP and Africa Coalition. I'm Bongi Sibanda, based mainly in the UK and also registered to practice in Zimbabwe, where I'm originally from. So I work in advanced practice as an educator, a consultant, and I work directly with patients. So I'm really looking forward today to share with you about APN work we are doing together with our colleagues at AfroPHC, particularly from a collaborative perspective.
Thank you. Welcome, Judy.
Good evening, everybody. Thank you very much, Dr. Joy Mugambi, for that warm welcome and for coordinating this webinar this evening. And thank you, all of you, for taking part in listening to Nursing in Africa. That's really, really, really heartwarming. Like Joy elaborated very for a long time. My name is Judy. I've just currently moved to Rwanda to take up the position of Chair of Nursing and Midwifery at the University of Global Health Equity, which is based in Butaro in northern Rwanda, although I'll be working out of Kigali. And as Joy said correctly, I've done a lot of work within the sphere of nursing and midwifery within Africa. I'm very happy to be here to just share a little bit of my work, specifically to deal with nursing now and universal health coverage and primary health care, and very, very, very humbled to be part of this wider accomplished group. Thank you.
Along with the panelists, we were expecting Lillian, Dodzo, and Timbeka. I don't know if they joined us or if they've not made it in, we'll still join them. Lillian, are you around? And
I think
Timbeka.
Lillian had given her apologies earlier.
Yes, and
Yes.
Timbeka, I think, had also given his apologies.
Yes.
So we'll move on to the presentation of Bongi, and I'll bring it up. Welcome, Bongi. Welcome.
Hello, Cynthia, I've just joined you.
Okay, Cynthia, please mute your mic and we'll continue with the presentations. Welcome.
Thank you. I'll dive into the presentation as we have gone through the introductions. My title today is Advanced Practice Nursing, a collaborative race towards universal health coverage in Africa. REST being the acronym for regulation, accreditation, credentialing, and education. Those who are not familiar with our work, which we started in 2017, leading to the formation of the Anglophone APN Africa Coalition in 2018, we looked at the scoping reviews. So we did a scoping review in sub-Saharan Africa, which I initially did as part of my doctoral work, my DNP at Queen's University Belfast, particularly because we were all striving to bring APN into fruition, trying to develop APN roles to meet population needs. But we're all doing it in silos and we're all meeting the same challenges. And what really needed to happen was for us to work together and collaborate, avoid duplication of work, and proceed this work together. The main document really that inspired our work was the Triple Impact Report that most people will be familiar with, which led to the All Africa, to the All Party, which was developed by the All Party Parliamentary Group on Global Health and led to Nursing Now. It highlighted the need for nurses and midwives to be involved in policy decision-making to influence healthcare, but also noted that the nurses and midwives could not do this alone and needed to collaborate with others in order to do so. Hence, the AfroPHC platform has provided us a platform to do that, together with our healthcare colleagues as same partners and at same level influencing policy in primary healthcare. Our work was supported by high-level organizations. These are international organizations who are key stakeholders in APN. They included the International Council of Nurses, the ICN APN Network, Nursing Now, and we are a local group member of the Nursing Now. JPIGO, an affiliate of the Johns Hopkins University, the American Association of Nurse Practitioners International Committee, AfroPen, Wonka Africa, the president at the time, Dr. Lawson, and the current president now, Shapia Musa, hence our existence within the AfroPHC space. And we couldn't have reached this stage without the assistance and the leadership from WHO Health Systems. Dr. Dovlov in 2018, and Dr. Tumusime, who gave us an opportunity to submit our proposal. So our vision was really to combine these efforts by individual countries, advocate and coordinate policy dialogue for APN at regional level. We wanted to see a competent APN workforce providing safe, quality, integrated care. And that can only be achieved if we are all doing the rest together. We adapted the APR and consensus model within an African context, of course. But also, we wanted to ensure that we start thinking about developing Afrocentric frameworks and models, because we know that the APR and consensus model developed in the USA in a high-income country was not specifically meant for African health population needs. The reason we actually opted for this, not because it was the most common consensus model, but it aligned very well with the APN programs and roles that we saw throughout Africa as we started to look at our data. So these were in particular order. The nurse anesthetist, that's the most common one in many sub-Saharan Africa. In fact, the nurse anesthetist provides about 80% in some region of anesthesia in district and rural level. Then there was the nurse practitioners / family nurse practitioners, the advanced practice midwives, who are really critical in addressing the maternal and neonatal mortality rates we are facing, which are still alarming in some of our countries. Then finally, the clinical nurse specialists. I just want us to look at the APN definition. So we are on the same platform about who we are talking about as an APN. This is from the draft guidelines from the ICN that was presented by Dr. Rogers at the ICN Congress in 2019. So some of my colleagues may have attended our workshops in Kenya and Ghana may have actually seen this slide before, but I think for the benefit of everyone, it's critical that we are clear about who is an APN. But do hold your breath there, because these were draft guidelines, so we don't know whether if they come out, they may be different from what we have now. But critical to the changes from the 2002 ICN deadline is that a master's degree is no longer a recommendation, but a requirement entry into APN practice. And so is credentialing, which is very important to us because it will allow us to have APNs moving across the region to allow the mobility and portability of skills. And to allow us to develop centers of excellence. Not every country needs to have an FNP, but we can also work on having centers of excellence where we train these FNPs or these nurse anesthetists or these advanced practice midwives. However, as you may see, there are two categories of APN that were identified on the draft guidelines, and we don't know either whether that's going to remain the case. As I have alluded, we cannot in Africa talk about APN without talking about APM. So for us, those four categories are key. So we'll need our nurse anesthetists and our advanced practice midwives. And the work we are doing is already showing the importance of this. And I just want to touch on the collaborative way we are working with regards to the 4 pillars of APN. So the clinical practice, research and innovation, leadership and management, and education. This work is mainly pulled out of the work we are doing here in the UK, where we focus on the APN pillars. And these are the pillars that we expect every APN to possess at the end of their training. I'll only touch on 2 and why there is need to collaborate. Clinical practice. We need to have specified hours for our APN students to achieve the required expertise to practice directly in clinical practice. They need to have effective supervisions in order to have quality education. And if we look at the assignments and assessments that are done in clinical practice, work-based assessments, which include MiniSECs, the DOPS, the OSCEs for physical assessment, These are the skills that nurse educators are not traditionally trained to do. Therefore, we have to collaborate with our medical colleagues, our medical educators who have been doing this, both for the benefit of the APN students and the development of the nurse educator. It also has implications on how we need to take forward the work of educating health professions educators, not only in Africa. This is an issue globally. We are still educating educators in silos when we actually expect them to be able to teach and to facilitate learning across health professions. So this is something I'll leave it in the hands of our AfriPen, AfriHealth, AAPE UK colleagues to help us and facilitate it forward. Research. Nursing has traditionally held research being only practiced in academic. If we want to really improve healthcare programs and health outcomes for our patients, this got to change. We need to have nurse leaders who are principal investigators, who sit in research ethics committee, who sits on boards of research ethics. And this way, we can really be assured that translation of evidence into practice occurs timely and that innovation is promoted. And APN is very well placed to actually fill that gap. Now, here is the good news. All the people, all the key stakeholders who are involved in these 4 pillars are available at the AfroPHC. So we'll be able to move forward, to build on this work together and to have this working in primary care and really improve research and innovation within emergency and primary care. Now, the coalition is coming to an end. It has done its course, 2017 to 2020. Not only because we have finished the cornerstone that we're using to apply the conceptual policy framework for advanced practice by Shoba et al. 2016, but time has come where we need to be in an organization with legal frameworks where we can have contractual agreements and hold funding, have an advisory board, and start looking at the next stage, which is implementation, monitoring and evaluation of these APN programs and roles. And we are really excited. We'll be revealing more details on this at the inaugural Africa APN Symposium. Now, the Africa APN Symposium, I'm not sure about you, but I am excited. Not only because Africa is going to be the first ever continent to hold such a symposium in the whole world, but we have the ICN APN network hosting this event. So you've got to be there. We'll be looking at the rest in detail. We have our colleagues, the leaders from JPICO. As you are aware, they have been working on the State of the World Nursing Report. We'll be having that detailed down to say what it means to us as African nurse leaders at sub-regional and country level. So you want to be there. You have had it all. We have high-level support. We have the AfroPHC platform to do this work and make primary healthcare a reality for every African. We are now looking for funding to make this a reality. But most importantly, let's collaborate and make this a reality for every African patient. Thank you, Siyabonga. See you in SA.
Thank you. Thank you so much, Bongi. That was lovely. Now we do know what APRN is all about. My question is this, as we move on to Judy's presentation, we can still give you 1 or 2 questions. So how can APN advance PHC and UHC in rural and hard to reach areas in African setting?
We know from evidence that has been collected by our colleagues in Tanzania in collaboration with Duke University, nurses in rural areas in primary care are now working well beyond their scope of practice, not because they want to, but because there is a need for them to do so. So we need to really upskill these nurses so they are appropriately working within a scope of practice that is legally acceptable, and also that they really provide the quality care required and with the knowledge and skills required to work at this level.
Still on the same, in terms of educational institutions, because not very many regions in Africa are training and integrating APNs in their system. How would educational institutions be reorient their nursing programs towards integrating APN?
I think, firstly, it has really to start with appropriate policy making and policy dialogue. We do not want to get to the risk where this is mainly controlled by the education institutions, but people will have to work collaboratively. So the ministries, missionaries, which are actually providing most of primary health care in many African countries, all key stakeholders, the regulators, they need to be involved from the word go. And we do not really want to risk a scenario where people have gone for training for 2-3 years, and then at the end of the day, they don't even have employment or the roles that they've been trained for. So there are quite a lot of things really that need to be addressed, such as the scope of practice, the prescribing, changes in legislation, and that's pivotal before we even go into curriculum development. So the deans of schools of nursing, the regulators, the Ministry of Health, the chief nurses have their own strategy for nursing and midwifery, and it must be clear that the APN roles are aligned to the chief nurses strategy for nursing and midwifery in each and every country.
Thank you. Anyone from the attendees who would like to ask a question to Bongi? Do raise your hand. Temima, I'll unmute you.
Okay. Hi, everyone. Pleased to meet you all. And thank you, Sibongi, for giving us highlights on the great work that you are doing in Africa. My comment that I wanted to give is, of course, the advanced practice nurse or midwife. I think looking at the definitions, you may need to sharpen the difference between the advanced practice nurse or midwife and then the nurse practitioner and then the other one. There's a need for this sharp distinction because of the tendencies for, if I may reservedly use, rivalry amongst us as professionals in terms of who plays what role when we come into the clinical setting or even in leadership position. So I think that probably the definitions, we may need to take a look at it again. My second comment is about the 4 pillars. Do I presume that policy development and change process and all that is integrated into the leadership and management pillar of the training, given the fact that this is very critical at that level of preparation for the person to be able to exhibit the qualities of policy development, policy advocacy, and making a case for the profession. One thing that I'm very excited about is the fact that we are going to ensure that the person is a clinical practitioner. I think that this is very, very critical if we as nurses and midwives can make a difference in our profession. Because often we train and then we leave our students for somebody else to precept. And the gap between theory and practice have continually existed because there is a difference between who trains and who mentors for acquisition of skills. And I think that this is something that is very, very good in what in the pillars that you have proposed, and which I think
Thank
as
you,
African
Jemima.
countries need to do.
Yes. Okay, Jemima. So, Bongi, you take that question. We'll take one more, and then you can answer.
Okay, this is Mwansa. Can I ask a question?
Mabendi, Mwanza, yes, you're on, and then Mabendi.
Okay. Okay, thank you, Bongi, and hello to everybody. I have just got a small question in addition to what I had sent to the leader of the PHC Afro. I want to find out, documentation of information is very important, and drawing lessons from what has taken place, what works and what doesn't work, for us to be able to make informed decisions. The advanced practice nursing is very important, and as you rightly said, it needs really to be advanced in a way that is understood by policymakers, and its importance, especially in a rural setting, to have competent nurses providing services there. So I want to find out whether you've been able to actually document these lessons and disseminate them widely. I would like to get hold of that information that you talked about, that you had done some studies in Tanzania. And, it would be very important for us to have that information widely circulated as a basis for us to move forward.
Joy, may I also ask a question? This is Judy.
Yes, Judy, you can.
Mine is a quick question. Bongi, thank you for that wonderful presentation, and thank you for the good work that you're doing in this very, very relevant field of nursing in Africa. The conceptual policy framework that has now come out as a tangible, deliverable or outcome of this good work that you've been doing since 2016, I believe. Is this now, what is the plan for this particular conceptual policy framework? Is it, I think it's somehow related to what also Mwansa is saying, is it that now African countries can take this to help them advocate for APN in their countries, or if it's just a conceptual document, is the understanding that it will be used by the countries to then develop their own policies? Perhaps just speak a little bit more about that. Thank you.
Thank you. I am going to start on the question on the 4 pillars regarding policy being on the leadership and management. That's absolutely correct. So what we are really encouraging most of our colleagues who have sought some advice from us is that they also include their chief nurses and their regulators in delivery of these modules on leadership and management, so they can embrace policy decision making and policy development. Then on Mwasa's question on the evidence, the Tanzania Duke APN work that I referred to was not done by myself, but by colleagues. And I can send the documents, I send the link on that. It's already published work. And I believe they did it 2 or 3 years ago, before actually they started planning their FNP program. So they already have an FNP program that has been approved, and this is at BSc level, which is different from the other programs that we currently have running. And if there are any colleagues from KCMC, please do the chat and correct me if I'm wrong. And my understanding is that you're probably going to be having your first intake either early next year and that the program has already been approved both by the ministry and the regulator for education. So that was for Tanzania. But we also have really clear evidence, particularly around the clinical nurse specialists in the sub-Saharan region on HIV, on TB, and the outcomes. And we can share that evidence too. Most of our work is not really found in peer-reviewed journals, so most of the work I found was through grey literature and some African journals that do not easily come up if you are searching for data. The normal way we'll do a systematic review, but we do have the evidence indeed. Our proposal, APN proposal, has case studies. It's got case studies of the work of colleagues who have done advanced practice midwifery and advanced practice pediatric in Malawi, Kamuzu College, case studies from Botswana, who have been doing FNP programs for over 4 decades, case studies Swaziland, who started their master's entry FNP in 2017, and so on. So we can still share that as well. Judy, on the conceptual framework, just to clarify, we applied the conceptual framework so that we apply an evidence framework towards the work we were doing. So from starting really to set the agenda for this work, to engage policy makers, to engage high-level stakeholders. So it's a conceptual framework that was developed by Dr. Shoba, Madrin Shoba, in 2016 with her colleagues. And is a framework that addresses policy. It's the only framework that addresses APN policy at present. But however, there's also another similar framework that is more suitable for those countries that already have established policy around APN, and that's the PEPA framework. So you may find that some countries may have used the PEPA framework for their curriculum development, but for such a highly political level across countries and across the region, the conceptual framework policy one was the most appropriate one to apply.
Thank you. May I ask a question? My name is Miriam.
Yes, one last one, and then now we move on to Judy's presentation, then we'll come back to questions.
Miriam, can I ask a question, Miriam?
Yes.
Yes, thank you so much. I'm joining in for the first time. I think it's very stimulating, and we'll be joining every day. And I want to ask that as we talk about the nurse practitioner and the ANP, there needs to be some difference in terms of entry points, because if we're looking at entry levels to civil service and we want to advocate for salary payments, then the Public Service Commission would like to see the 2 levels so that they differentiate the salaries for each level. If we just leave it as anybody can be advanced nurse practitioner, then that jeopardizes the objective of going for further studies. Then number 2, I know that in Kenya, the government is currently talking about community health workers who are not very highly trained. So as we talk about the ANP, I think it would be important for me to understand how the ANP is going to take control of the community health workers, because many times people think that the community health workers are better than the ANP nurse. But I believe that in the rural Kenya, where we do not have very many people who can make critical decisions and promptly to impact patient health outcomes, we need the ANP in the rural Kenya. But there should be some linkage of how the ANP is going to work very closely with the community health workers to be able to help the population at the family level access quality of care. Thank you very much.
Thank you. Bongi, I give you a minute to answer that as we load up the presentation for Judy.
Sure. I think you are right. Absolutely. That's the reason why we are doing this work to ensure that there are clear standards. And we also have a mandate as nurse leaders to ensure that the public is protected. Those who are calling themselves APNs have the right education, the right skills, and have acquired the right knowledge that is legislated for them to call themselves that and to practice at the level they are practicing. With regards to community health workers, the FNP is very well placed to actually lead on the development and supervision of the community health workers,
Yes.
as well as really to hold them into accountability, so that we are clear about what they are training and who is supervising them and what's the period of the training they acquired. Right now, this is not happening, but the FNP is appropriately placed to do that.
Thank you.
Thank you. So Judy, we are up and running. Welcome. Oopsie. So welcome, Judy.
Thank you.
Oopsie.
Very short. Can you hear me?
Yes, we can hear you.
So I'm just going to briefly talk about Nursing Now. I have, I think, 4 slides, and I'll just go through them very quickly. I think most of you by now are very aware of what Nursing Now is. It was launched globally on the 27th of February, and it's run in collaboration with WHO and the International Council of Nurses. And if you go to the website indicated there, www.nursingnow.org, you'll get all the information around Nursing Now. Just back up, yeah. And basically the Nursing Now campaign was started in 2018, 3 years to the forerunner of 2020, which we are now in to the 200th anniversary of the birthday of Florence Nightingale, who is universally considered the founder of modern nursing. And the aim of this campaign came out of what Bongi mentioned earlier, the Triple Impact Report by the All-Party Parliamentary Group in the UK, which looked at the triple impact of nursing on 1, gender, on 2, health, good health outcomes, and 3, on economic empowerment. Especially here in Africa, we know that women are often, as much as this is not documented and put out there, but we know that when you educate a woman, you educate a family, you educate a community. And the fact that majority of nurses are women mean that when these nurses are educated through their nursing and working as nurses, they lift the standards, the economic standards of their families. So the Nursing Now campaign was just put forward to improve health globally by raising the status and profile of nursing and midwifery. And we are using this 200th anniversary of the birthday of Florence Nightingale to really just harness and raise the status and profile of us nurses, to empower nurses to take their place, to improve perceptions of nurses who are often just seen as slightly more than I want to say a maid. I have been called a maid in my life as a nurse, to enhance their influence and maximize their contributions to ensure that everyone everywhere has access to health and healthcare. And its main advocacy is that nurses are a key part of the solution to today's health challenges, including primary health care and all the different global goals that we have. And if they're properly deployed, valued, and included, then there will be a very big difference. And of course, this is not just done alone. We are involving citizens, the nursing community, politicians, and other leaders in the campaign. I am the Nursing Now Africa representative and have been moving the length and breadth of Africa to really just drum up support for this. Next slide. So one of our champions is Dr. Tedros, who is the WHO Director General. And he says, of course, as we all know, the world faces a shortfall of 18 million health workers who are needed to achieve and sustain universal health coverage. And more than that, and more than half of that shortfall, of course, is nurses and midwives. And I know I'm preaching to the choir. We all know this. He's one of our champions. And I know that one of the things he did as he was campaigning to become the Director General of WHO was actually put a statement that said that WHO would have a chief nursing officer, which I think has not happened before. And on his appointment, they did appoint Elizabeth Iro, who is WHO's chief nursing officer, sort of just lending or throwing his weight behind nurses and midwives. Next slide, please. So 2020 is the year of the nurse and the midwife, and this has been officially declared by WHO. And it's a once-in-a-generation opportunity to put nurses and midwives at the center of global and health policy, and a celebration of all that nurses and midwives do to improve health and healthcare. So all across the various countries in Africa, there's a lot of hype, there's a lot of activities, there's a lot of things that are happening to bring to the public the importance and the work, and to celebrate all that nurses and midwives are doing and the work that nurses and midwives do. Here's my last slide. So when we are looking at universal health coverage, one of the things that nursing now is working and throwing its weight behind is to invest and develop the nursing and midwifery workforce. In particular, we are looking at having more nurse-led clinics. So a lot of what Bongi is saying really goes to this, that when we have APN, nurse practitioners, FNPs, clinical specialists, all of these nurse-led initiatives are really critical to ensure that there is access to quality healthcare by most of our populations here in Africa. We're looking at more specialist nurses. We want to develop the midwifery services, develop primary healthcare, which is one of the reasons we are here with AfroPHC. And of course, last but not least, the health promotion and disease prevention. So broadly, this is just an outline of the Nursing Now campaign and what we are doing. We have a few milestones coming in April. We are going to release the State of the World Nursing Report, which is the first of its kind. We have released the State of the World Midwifery Report, but we've never released one for nurses. So that will come through, and this has been a collaborative effort with countries globally to submit data and information on various aspects of the nursing workforce that has then culminated in this particular State of the World Nursing Report. Then of course in May we have the Nurses Day, and most countries are really working around the clock to drum up a lot of hype and a lot of, stuff for nurses that you'll see coming through with the media and so on and so forth, that will just continue to highlight this. This campaign ends in October 2020, and between now and then, we're really hoping that a lot of work of Nursing Now will be able to put nurses at the forefront of decision making and allow decisions to be made now from 2020 onwards that are really beneficial to nurses, that bring nurses to the decision making table, and that ultimately really, by raising the status and profile, we then are able to provide care for the population. So thank you very much.
Thank you very much, Judy. That's a very lovely presentation. We are so excited. This is the year of the nurse. We look forward to a lot of activity and collaboration. I note there's a few queries. Jean Perry, Fina, talks of APN concept is integrated in Democratic Republic of Congo, and the levels of the roles of APN depend on the context in rural areas, where they are very helpful in the healthcare system. So that means APNs really are doing something great out there. Proud of what they are doing. In the urban areas, their roles are different, as most of them are in the hospital context. We have Madrine Scoba, who says, when appropriate, I can tell everyone when the ICN APN guidelines should come out. Guidelines are in process for nurse anesthetists and nurse prescribing. We'll give you an opportunity to talk about that, but in the meantime, I welcome questions for Judy. Thank you so much, Judy. It's nice to hear what is being done. We look forward to a lot of activities as the year winds down. And we are so proud. I was brought up by a nurse, and I became who I am because of what she believed I would be. And I do say this year will be a great year. We really honor the nurses for the work that they are doing.
Thank you.
So I welcome questions. You can raise your hand, you can unmute.
Ask a question. This is Monsa. Hello.
Welcome.
Go ahead.
Okay, Judy, thank you so much. It's nice to see you again for your presentation. I just want to find out how you are linking up with Afro on the Nursing Now campaign, because I'm trying to support them on some activities. So I want to find out how you're collaborating with them.
Afro by Afro, you mean AfroPHC?
The WHO, sorry, WHO.
Oh, WHO Afro, yes. We have been in close discussions with Prosper Tumusime. We also have within the Arusha Secretariat, which hosts Hexacon. So that's been the bigger vehicle that we've been using through Nursing Now, and Mr. Alphonse is the Hexacon person, who's been involved with Nursing Now within the Afro space.
Okay, it's good to know, because I'll be there for a week next year.
Please reach out to Alphonse. He's very much in the picture regarding what we are doing.
Okay, thank you so much.
Any more questions for Judy, for Bongi, for Wonka Africa? We are open to questions too.
Hi, Dr. Joy, it's Bongi here. Would you like to bring in Dr. Madrin Shopa to highlight us about, to inform us about the work on prescribing and the guidelines, because I think that's key as well.
Yes, that would be
Thank
lovely.
you.
Madrin, please do have the floor.
Thank you for inviting me, number one. Thank you, Bongi, and I want to make sure to emphasize that on behalf of the International Council of Nurses, we are in regular contact with Bongi and other members of the African community. After approximately 2 years of working on the advanced practice nursing guidelines, you should see the complete guidelines within the next 2 to 3 weeks. The final copy is in graphic design in Geneva at ICN headquarters. And I wanted to add that to a question earlier about increasing the definition or description between the multiple roles of advanced practice nursing. The document and the guidelines that are coming out are over 40 pages long. So you will have an opportunity to look at these guidelines, and specifically these first guidelines are differentiating very, very specifically CNS and nurse practitioner. But you can look at them in detail and look at the references, which include references from Africa, and then look at your particular context to see how that applies. So I encourage you to look forward to seeing that, and as soon as it can be distributed, I'm sure that your leaders will make sure that you see copy. I wanted to also mention, I'm very well aware of the fact of the high percentage of nurses doing anesthesia in sub-Saharan Africa. And simultaneously, ICN is also in process of developing extensive guidelines for nurse anesthesia. Our representatives at this point in time are from Ethiopia and Kenya, and that is in process and should be out later, maybe about the middle of the year. And then in addition, there will be guidelines coming out for nurse prescribing in general. In other words, the view of the International Council of Nurses extends from those nurses in any context that have some authority to prescribe up through the advanced practice nurses. That will be a very much a continuum of different opportunities for nurses to do prescribing, and there will be a special emphasis on the differences in as it relates to vaccines and vaccinations and so forth, as we're very aware that the differences among the countries is quite dramatic. In the United States, we cannot prescribe vaccines on our own, whereas I know in some countries, community health workers can give the vaccine. And then perhaps lastly, I want to emphasize what Bongi mentioned earlier, and that is there is every hope and every intent that as advanced practice nurses evolve, emerge, develop, that of course they would be working with and in collaboration with community health workers and other healthcare professionals. At this point in time, there is not a document in process for the advanced nurse midwife, but we're very aware that this is a discipline where international guidelines through ICN will be looked at. I'm not sure when that's going to happen, but in general, the topic, the idea of nursing at an advanced level is a very hot topic, if you will, right now, and many countries are looking at how this will develop and how it fits the context of the needs of your country. So again, I thank you very much for letting me make that announcement, and I'm happy to answer any questions if you have any at this point.
Thank you very much, Madrine. It's great to hear about the guidelines, and we will share even with the other nurses that we have in our countries. And we look forward to learning more about APN and sharing more about what they do. I welcome questions to Madrine or Bongi or Judy.
Hi, everyone.
Welcome, Bendy.
Yeah, this is my baby.
Yes.
Yeah, from Botswana.
Welcome.
Okay. I did come late, but at least I just wanted to just say I'm so happy to hear that the guidelines for APNs will be are on the way, but also I take it that we are all aware that even if it's APN guidelines, the country context and whatever, within the healthcare system of a country is the one that will determine how you incorporate the guidelines within your APN or NP, practice. Thank you.
Welcome. Any other question? I think we are almost coming to an end of this webinar. I feel very biased. The gentlemen in this group have not spoken. Arun, Champion, we need to hear your voices. You can say something. Arun is walking and you seem to be in a very nice environment. Say hi.
Yeah, hi everyone. Today is actually first time that I'm going through this, and I have to be traveling from Monrovia to Banga in the interior, and I have to stop somewhere on the highway to make sure that I'm part of this. I think it is great. It is a great idea that is being brought up in Africa, and we hope that this is going to materialize and it works.
Thank you very much. We appreciate the sacrifice that you have made. Have a safe journey, and we hope that you can join us in the other meetings that we'll have. Champion?
Hello, everybody. I just wanted to say that Bongi and Judy did fantastic presentations, and Judy's talk about the Nursing Now campaign, I think you really brought an interesting perspective on what it should look like and what we should all be busy being involved in. And I think it's brilliant that we still have a lot of activities planned out for Africa. When all of this was panning out, I kept on asking myself, what's the level of involvement from organizations like in our side? I'm from AfroPHC, and how we can actually elevate the status of nursing within our interprofessional environment. So I think, Judy, that was a very interesting and eye-opening talk. But again, it's also interesting to also meet everybody that has come up to this webinar, and I hope to see you guys in the next session again.
Thank you very much. Yes, James.
Hello.
Hi, welcome, James. Jean-Pierre.
I'm Jean-Pierre from Congo, Kinshasa.
Yeah.
I'm very interested by the two presentations. And I think that in my country, the healthcare system was already developing this, what I can say, this process of advanced practice nursing. Before this presentation, I was always thinking that it was for the healthcare system to face one of the means or the ways to face about the shortage of medical doctors, mainly in rural area. But after these two presentations, I had a little change in my mind. So the context in our country is that in rural area, it's mainly nurses who are piloting the system. In urban areas, the situation is more different, but in rural area, what they have described are already happening. And one interesting thing is that the education system are organizing courses like a master's so that they can have a formal education about it. Thanks very much.
Welcome. Thank you, Jean-Pierre. We appreciate. Thanks to the gentlemen. I really had to give you opportunity to talk. You are all very silent. In my country, we have the 2/3 gender rule, and we really had to implement it on this. I will make a brief presentation as we started off, as a reminder of where we started off, why we are here, AfroPHC. When we sat down with WHO Africa, they felt we all work in silos. I am a family physician. Today we are talking with nurses. Tomorrow we'll be talking with doctors and clinical officers. And on the other end, we'll be talking to community health workers. They felt we all work in small silos, and our main strategy is to deliver healthcare at the primary healthcare level. But if we do come together, our voice will be way much stronger. And the reason why we are holding this webinar is to introduce each other first and then bring in our agendas together. More about AfroPHC, as I've said, it's all about bringing leaders of the primary healthcare together, bringing the family doctors, the nurses, the associate clinicians. In Kenya, we call them the clinical officers. Some parts, they call them the physician assistants, the community health workers, and others who are in the primary healthcare space. Then with this, we aim to support each other, advocate for proper, appropriate teams that lead the PHC team as we aim towards UHC. UHC is coming up in most of our countries. It seems a new concept, but who are the leads of UHC? Without PHC, there is no UHC. So we talked about the orientation, but this is the slide I would like us to remember. Do join AfroPHC. We have regular webinars. We participate in discussions on Google Group. We do online trainings on leadership and management. This is coming up. You'll find them within our website and the Google Group. This will be shared. The trainings are being offered by AMREF University. And it's really an exciting thing because this is part of what we are coming together to do, to build leaders and to be able to manage our healthcare wherever we are. We also would like to link up with PHC team leaders in each country. So we would encourage each country to form local AfroPHC forums. Then join us also in AfroPHC conference, which will be on 19th to 21st June in Johannesburg, South Africa. Do diarize on that, and to get to know more about that and to register, check out our website, which is the www.afrophc.org. Other than that, most people ask, what is WONCA? WONCA is World Organization for Family Physicians in short. In long form, it includes the academics. We also have associate members, and our associate members are drawn from the primary healthcare platform. That's the nurses, the clinical officers, the community health workers. We fall under 7 regions. There's the World the World Organization, which is the global platform for WONCA. And we also have now the 7 regions. WONCA Africa is one of the 7 regions. We have Europe, we have Asia, we have the Caribbean, the US, and all the regions are broken out, which all have leadership within that, the region. In Africa, our president is Professor Shabir from South Africa. You'll be seeing him in future webinars, and also you'll meet him in Joburg. He's the one who's currently heading that conference. We also have me as the Secretary General. We have our treasurer who comes from South Africa also. She's called Reggie, and she is leading what we call the WONCA Women Working Party. The WONCA Women Working Party looks into issues about the woman in Africa, in the region, and advocates for healthcare needs of that woman, along with the practitioners, the female practitioners, workplace issues that affect the female healthcare practitioner are also addressed within that committee. We have several other working parties. One of the most active working party is the Young Doctors Working Party, which is called AfriWon, Africa, WONCA, Renaissance. That forms the AfriWon term. This young group of family physicians collaborate together, they do research, They do also quite a number of activities and exchanges that really help bring them together. And we hope that within this AfroPHC platform, we'll also be able to bring in the young nurses, the young clinical officers, the young community health workers, because their agendas are different. The current workspace has limitations. There's a lot of issues that are affecting them. The other working groups, there's quite a number of working groups and special interest groups which one can join, and you can check our website. It's wonkaafrica.org. Do join us. Do check out the activities that we have. We have a Facebook page, and we look forward to seeing you in Joburg and collaborating in so many other things. We thank you. Thank you so much for joining this presentation tonight. If there is any questions, any comments, I'll be glad to take them. Our next webinar will be on the 21st.
Thanks, Joy. It's Bonnie. I just wanted to highlight to colleagues that we have Anglophone Africa APN leads in each country. So at the moment, we have 12 countries across Africa who are working with leaders in family physicians. So the Wonka leads for that same country. And our main focus at the moment is the development of the framework for FNPs. So if you are not sure who your leader is, please don't hesitate to drop me an email and I'll respond. Majority of our leaders are leaders within their own countries as senior nurses. So they are nurses working at senior level, either at Ministry of Health, or they are in regulation, or they are within National Nursing Association. So drop us a line and we'll let you know who your lead is, who you can work with, particularly around the development of APN. They are paired with international experts, and majority of them come from the ICN APN International, ICN APN network, as well as the American Association of Nurse Practitioners and ex-professors who are already teaching and developing APN programs, either in the UK, USA, Canada, or in Ireland. Thank you.
Thank you so much. We hope that we will be seeing you on 21st when we have our next webinar. Do join us, do learn more about what others are doing out there and how to collaborate. And we look forward to so many more collaborations and lots of activities within the primary healthcare platform as we advocate and create policies that really will get us moving forward as primary healthcare practitioners. Thank you so much. Judy, anything you have to say before we close?
Just to say thank you very much. And I would really like to urge all the nurses in their individual countries to sign up for Nursing Now and to really get involved in activities for Nursing Now for this year, just to keep the hype and the momentum. Thank you, everybody.
Thank you. Good night to those who are going to sleep. Good day to those who are starting off their day. For us, it's 10 p.m. It's sleep time. Yeah. We look forward to seeing you on 21st. Watch out for the link and do join us. Thank you so much. Have a good night.
Bye,
Thank
everybody.
you. Bye.
Bye.
Bye, everyone.